Well, thank you so much for coming. I'm Maura Quinlan. I'm an OBGYN trained physician, and my role is Women's Health Medical Advisor for IDPH.
I'm Edem Agamah. I'm a professor of hematology and oncology at the SIU School of Medicine at the Simon Cancer Institute in Springfield. And I'm also someone who has interest in cancer genetics.
Perfect. So glad you could join us for a few minutes. So while we're talking about this, the big first question is what is genetic testing for breast cancer, and how do we decide who should get that testing?
Genetic testing for breast cancer is a broad term that is used to identify people who have inherited susceptibility to getting cancer. That is, they were born with some defects in their genes, and these defects are not usually manifested until later on in life. And so some of those defects affect people who are at a higher risk of having breast cancer. So when we talk about genetic testing, we're talking about a procedure where you see your doctor, there's some counseling that takes place, and they try to explain to you what you're getting involved in because it has implications. And so we have a pre-test counseling, and then you have an understanding what is your concerns and what you expect to get out of the test, and then we do assessment whether you need this test or not. Usually it's someone who doesn't have cancer who will come to the doctor because they have concerns about breast cancer in the family, and they ask, am I at the risk of having breast cancer or not? So the doctor will talk to you and explain things to you, or they might send you to a genetic counselor if it's in your area, and then you send you to do some blood tests, and the blood test will identify whether you have a specific gene mutations, and these genes, if you have mutations, increase your likelihood of having a breast cancer. So that's basically what it's involved, and then after the test results are available, you see the doctor again, and they explain things to you, and then you can make a decision about the best things to do. And most of the time, the results may be negative, and it gives you reassurance. And if it's positive, also they can give you assurance about what to do to prevent cancer from coming. Later than normal. What to do to prevent a cancer from coming.
Gotcha. So what are some factors that would make a person a higher risk? Who should get the genetic testing? You said a family history?
Yeah, family history is someone who has a family history of breast cancer that occurs at an age of, usually an early age. The thinking now is that if your family has a family history of breast cancer occurring before the age of 50, that increases your risk of breast cancer. If somebody has a family history of 2 breast cancers in the same person, that increases your risk of having breast cancer. If somebody has a family history of ovarian cancer, that is, mama or auntie, sister ovarian cancer, that increases your risk of having breast cancer. Somebody has a family history of pancreatic cancer or an aggressive type of prostate cancer, that also increases your risk of having breast cancer. And if unfortunately you have no family history and you have a family history of what we call triple negative breast cancer, in the past we didn't know a whole lot about that. That is, you don't have any receptors. Now we are identifying that those who have what we call triple negative breast cancer do have quite a large number of them do have mutations that would lead to breast cancer, gene mutations. So that will increase their likelihood of having breast cancer. So there are several things that are put into consideration before they say that you are someone who could benefit from genetic testing.
So if someone talks to their physician and sees that they have that family history and goes to the genetic counselor, what information does that patient need to bring, or what's the optimal information that they need to bring to that genetic counseling visit?
First of all, the patient, or it could be someone who just concerned, not a patient in particular, someone who comes, worried about, their risk, susceptibility, they need to bring some adequate information about family history, who has breast cancer, and at what age they have the breast cancer, and do they have any, second breast cancer in the other breast or not. Do you have anybody with some other cancers like ovarian cancer or prostate cancer, pancreatic cancer? They need to get that information. They need to go to their first degree relative, that is sisters, parents, or children. They need to bring information on that. The aunties, cousins, or grandparents, they need to bring that information.
Details about the person who had the breast cancer.
Yes, and also if you have a male breast cancer, some people may have male relative with breast cancer or prostate cancer, so they need to bring that information. So if you come to the doctor will be unable to help you if you don't bring adequate information. And these days families are scattered all over, so
Yes.
it's important for you to talk to family members, ask relatives, I'm going to see my doctor, and do you know anybody who has breast cancer? Do you know anyone who has this prostate cancer? Anybody who has ovarian cancer? Don't ask that question. If they don't have the information, go to the next person to ask that question, because the more information you can get from the family history, the better it is for you.
Are there any ethnic groups, any factors other than history of breast cancer that should make someone consider testing?
Yeah, there's some ethnic groups like Ashkenazi Jews. They have a highest risk of breast cancer, almost 8% prevalence of mutations of BRCA1 and BRCA2 mutation in that group of people. And of course, whites have a higher risk than blacks. Blacks have the lower risk, but unfortunately, blacks have a triple negative breast cancer. So we're now seeing that blacks who have triple negative breast cancer have a higher number of BRCA1, BRCA2 mutation.
So if someone meets the criteria, has mom, sisters, has a strong family history of breast cancer, and goes to get genetic testing, is it usually covered by insurance? What's the financial cost?
Well, it used to be very expensive, but not anymore, because the cost of genetic testing has reduced considerably. And for the appropriate person who is meeting the criteria, most insurance companies pay for it. And even if you don't have the insurance coverage, I think in the state of Illinois, as I'm learning, the state of Illinois is able to generously cover that for us. And so that makes it very easy for us to make that determination, because it saves a lot of future costs if it's not screened. Because knowing that you have a genetic mutation will prevent you from spending more money down the line. You can prevent cancer from growing.
So we were talking about the Illinois Breast and Cervical Cancer Prevention Program in the state now covers the genetic screening. So I've had patients over the years ask me, talk about being worried about being tested because they worry what that will mean for their future, getting health insurance. Will health insurers be able to know that information? Is there any grounds for that worry?
It's a legitimate concern, because we don't live in a perfect world, and we live in a very difficult world because of discrimination. If you know that your employee has genetic mutation, which will make you have a cancer, it's very easy for you to look at that as very high risk profile. Your insurance costs will go up when that person gets cancer. So there's that human tendency to discriminate against that person. But there are laws against that. Genetic Information Discrimination Act, we have the laws against that. And but people get away with that because the laws are not well known and well enforced. But most people should not be afraid of that, because they are protected. Genetic Information, Non-Discrimination Act, they should not be afraid of that. There are laws to protect you from that.
Yeah, that sounds great. So what happens to a person if you see a patient who comes to you who has this family history, is 35, pre-typical age of screening? What does that mean for someone screening? If they get the genetic testing and they have the BRCA1 or 2 mutation present, how will their screening change from someone who is negative?
If you're 35 years old and you have a mutation and you don't have breast cancer, then there are so many questions we gotta ask. One, have you finished having your family? Do you want to have babies or not? Are you going to breastfeed? Because we know that if you don't do anything about the knowledge that you acquired, you are highly likely going to have breast cancer. There's about up to 7% chance before you die, have breast cancer. So you got to decide when, do you make intervention, and then intervention, will require you making a decision about doing prophylactic mastectomy after you have you finish your family, or having a screening test. The screening test that we do, which is more aggressive than the usual. We do mammogram, alternative MRI of the breast, every 6 months. Like if you do mammogram today, 6 months later MRI of the breast, just to make sure that we can detect the breast cancer right early. So that is a little bit different from if you don't have the mutation. If you don't have a mutation, then you go by your life normally. But if you have a mutation also, we can also say, look, I finished having my children, I'm in my family, I don't need to worry about things, and I'm going to just go ahead and have a prophylactic removal of my ovaries, because the ovaries could become the focus of breast cancer. So you have major life decisions to make about removing doing parts of your body by surgery, which are not necessarily involved by cancer, because you don't want to be involved by cancer.
Yeah.
And more importantly, now that you have been diagnosed with a genetic mutation, you become an advocate for breast cancer in your family. So you reach out to your family members and tell them, look, I have this gene, BRCA1, BRCA2, or whatever gene that is found, I have that. Can you go test it with my sister? Can you get tested? Because it may make a difference in your life. So you have a lot of options to pursue once you get tested.
That's a great idea, just to be an advocate in your family, to get tested early.
Yeah, because if you don't, some people don't want to test it, which is okay, because they don't want to know.
Yes.
And we have to respect that autonomy that they have. We got to make sure people are comfortable, people understand the implication of being tested, and people differ. So people who don't want to know maybe coping with adversity in life, and so we have to protect them until such time that they're comfortable to be tested, and that they can have that. But as I said before, they need to have a pre-testing counseling, and they need to have post-testing counseling, because it has major implications.
Especially that comes up sometimes. My patients ask about doing like the 23andMe. I've had patients say, I don't need the counseling, I'm just going to do the online based. What is your thoughts about that, the breast cancer screening? Because they say those 23andMe will say that we'll do cancer genetic testing. 23andMe
is in the news these days, because as you know, they are out of business, which is unfortunate, but it's an effort to bring genetic testing closer to home. But I think it's oversimplified a whole lot of things. Although I understand they have people engaged, to counsel the patients and so forth. If you're concerned enough to have a genetic testing, I think the best thing is to talk to someone who has knowledge, who has experience, who can help you navigate you through the complexity of this. And so I will not sit in my living room and be doing a saliva swab and putting in the bottle, because what say I have some weird mutation, then I'm looking at the internet, I'm more confused, and I got problems, and now they said I have all these mutations and so forth. Am I going to die? It's not a burden that you want to carry alone.
Yeah.
We have resources, to share the burden, so that you don't have to carry it all by yourself. Because if you do it all alone, it'll be too much for you to carry. Too much for you. So I encourage people to talk to their doctor.
And get that post-test counseling, because I'm sure if you get something saying you have a 70% chance of cancer.
Pre-testing counseling is very critical. Doing the test is just a blood test.
Yes.
That's the easiest. The pre-testing is counseling is very important, and post is also even more equally important. Because let's say you find some abnormal genes. What are you going to do with it? Right. You got to know. Are you going to go say, I want it out? Say, not so fast.
Yeah.
A lot of people don't know that they could still keep their breast with mammogram. They could keep their breast with MRI alternating to side point that they finish their family.
Yeah.
People don't know that.
Right.
Because you're worried about cancer coming back. You're worried about getting to the point where you get treatment. So which understandable, but you could be helped when I get through that to a side time it's appropriate for you.
Yeah, that makes total sense. So what if a patient is not ready to have the prophylactic mastectomy to really reduce their risk, and they are getting their 6-month alternating MRI and mammogram that are obviously expensive, will insurance cover that if they have the known genetic mutation?
Most insurance will cover that. I'm sure, the breast cancers and cervical programs will cover it, because, we don't have to have one size fit all for someone. If I want to, breastfeed my child, if I want to be able to make sure that I finish having my family before I have prophylactic, I think most insurance companies will cover that.
Are there any resources that you would point someone to who you have counseled, done pre-test counseling, any resources for patients to get more information about genetic testing, since the internet is a scary place with a lot of incorrect information?
CDC has information. CDC has information, and American Society of Clinical Oncology have information on breast cancer and genetics. In fact, they are leaders in educating the community on genetic testing, and various groups also, national groups like NCCN, the National Comprehensive Cancers Network group. They have patient-friendly information that people can see. Some of those things can be very intimidating. So I said everybody should talk to their doctor or primary care providers and help you understand this, because we don't have to carry this all by ourselves. We need each other to help us navigate through this maze.
Yeah, and I think some of the things that say your risk of breast cancer is X, the end, instead of it is that on your genetics, but testing prophylactic mastectomy can reduce that risk significantly.
Yes.
So it's not like it's an inevitable.
No, it's not one and done.
Sure.
Yeah, it's just knowing is important because it helps you prepare to prepare for future adversity.
Right. If someone comes to you and has a strong family history, but they get genetic testing, or they tell you that their genetic testing has been negative, is there a freak? Do you tell them to get retested? I know that they used to be BRCA1 and 2, and now there's CHEK2. The number of genes associated with breast cancer is increasing. If someone has that really concerning family history, but negative genetic testing that they had 10 years ago, would you tell them to get retested?
Yeah, so 10 years ago, we didn't know a whole lot.
Yeah.
We know BRCA1, BRCA2, but now we have other things like CHEK2, we have PAP2, we have that, we have ATM gene, we have that. And so some of those genes are newer genes that have been found, not very common like BRCA1 and BRCA2, but they can also lead to breast cancer. So if your test is old, you don't have a multi-gene panel evaluation, because of the decrease in the cost of the testing now, doing 1 or 2 tests is not cost effective. So most platforms add so many genes to the testing. So you can have germline mutation testing for various genes, which is cheaper than it used to be. So if your test was done a decade ago, and say, look, I want to see the result. Because as a doctor, the patient has some information, but it's better if the patient provides a written documentation of what was done. So I'll look at that carefully and say, oh, you didn't have this, let's repeat the test. So that's what I'll do.
To be sure.
Yeah, to be sure. If you don't have that information, I will say, let's do it again.
Are there any lifestyle changes if you see a patient who has BRCA1 or 2, and you've talked about the increased surveillance, now the MRI and breast cancer, the MRI and mammogram screening? Any lifestyle changes? If people say, what else can I do knowing I have this high risk?
Well, the main thing we talk about in general for anybody is maintain a healthy lifestyle. That is exercise and watch what you eat or what you drink, and avoid gaining weight if you can. Avoid gaining weight, losing weight, because some of these factors are associated with a high risk of breast cancer, and depending upon the type of breast cancer, so be conscious about exposure to some hormones, hormones before menopause, or hormone birth control pill, and also post-menopausal estrogens, avoid those, and just maintain a healthy life, eat healthy, and have a strong relationship with your doctor. If you're afraid of doctors, this is the time to become friends with doctors. You need someone to be by your side. You need someone you can trust and talk to.
And especially a breast center that's used to this, that is comfortable with all the testing that you need.
You need someone to be your, someone you can go to and help you navigate through this.
Yeah. Is there anything else we haven't covered that you think patients should know about genetic screening for breast cancer?
Well, I think it's not one size fits all. It's not like you have breast cancer genes, so I'm going to die. We're all going to die at some point in time, but people should know that whereas your risks are high, you could still prevent it by doing the right thing, and early detection is always very, very good to pursue. That is let's say for example you get diagnosed with a genetic mutation at the age of 35, which means that for the rest of your life you're going to be tagged with that. There are times that you're going to forget.
Yes.
You're going to forget to go for mammogram or MRI. You're going to forget that, especially if you don't do prophylactic mastectomy. There are times if you do prophylactic surgery or take your ovaries out of camera. So make sure that you maintain close relationship with your providers. Make sure that you understand your body. If you're not going to have surgery, know your breast, know what it feels like. Make sure you don't dismiss things and so forth. Make sure you have well authoritative information to guide you, because you're not alone. As I said, you have the community of doctors there to help you take you through this journey. So what I would say, people should just know that it's not only breast cancer that you're talking about. It affects other family members. Like I said, ovarian cancer, pancreatic cancer, and a high risk prostate cancer. And so that's what I would say people need to know. And then it's very important to talk about family history when family reunions, talk about family history. I know for privacy reasons you cannot share everything to her, but this is one disease that if somebody said, look, I got a breast cancer and I'm 35 years old, this is something that, it's catastrophic to me, but I want to do it so that nobody in the family gets stage 4 breast cancer because they didn't know that.
Yeah, so they could be diagnosed earlier. Yeah, that sounds great.